Hello, everyone, and welcome to Candid Conversations, real people, real stories, real impact. A podcast from 120 Under 40, the new generation of family planning leaders, where we talk to family planning and reproductive health champions from around the globe and take a deep dive into current topics in family planning and reproductive health, as well as the personal journeys of our family planning champions, the challenges they faced, what excites them about the future, and advice for other up-and-coming leaders. We are thrilled to welcome you back for episode 7, where we meet 3 of our 2020 Ingenuity Fund winners and discuss their project. Before we get started, be sure to subscribe to our YouTube channel. The link will be in the description of this podcast. And don't forget to hit that notification bell to be the first to know about upcoming episodes. We have a number of exciting conversations coming up that you won't want to miss. Without further ado, I'll allow our guests to introduce themselves and their winning Ingenuity Fund project. Welcome, everyone.
I'm happy to be here. My name is Margaret Bolaji Adebola. I'm the founder and executive director of Candid Initiative. And I will say I'm a proud winner of the 2020 Ingenuity Fund. And it's been really glad to do this with other winners. And I'll let them introduce themselves.
My name is Adebisi Adenipekun. I'm a senior associate with Sidani Group, based in Nigeria. Sidani Group is a management consulting firm based in Nigeria. I'm happy to be an Ingenuity Fund winner, and I'm glad to be on this conversation with you.
My name is NkasiObim Nebo. I'm the founder of Peach Aid Medical Initiative. And I'm happy to be here.
Thank you very much. So our project for the Ingenuity 2020 Ingenuity project is linking underserved population to sexual and reproductive health services. That's LOOPS project. And this project was designed to strengthen community partnership towards improving access to sexual and reproductive health services, including family planning and menstrual hygiene products among girls and women of reproductive age in Wassa IDP camp, Federal Capital Territory in Nigeria. Of course, this project was implemented by a consortium of 3 organizations, and I'm glad that we all have our representatives here. One is Sidani Initiative for International Development, Peach Aid Medical Initiative, and Stand With a Girl Initiative. Women, of course, we know in internally displaced persons camp often lack access to sexual and reproductive health. And according to UNFPA, access to reproductive health care, including family planning, often determine if women and girls in crisis live or die. So the LOOPS project was designed to improve access to family planning services to these women at the internally displaced persons camp through implementing a mobile technology intervention and community sensitization through outreaches. The 1-year-long project was actually implemented in the Federal Capital Territory in Nigeria. And of course, it was at the internally displaced persons camp in Wassa village, a rural community in Nigeria. It has a population of approximately 5,572 internally displaced persons and 821 households from different parts, majorly the northeast of the country. About 70% of the total population are children and young women of reproductive age, with most of them bearing more than 6 children before age 25. Family planning services, distribution of menstrual cups, and economic empowerment to women were the key focus of the LOOPS intervention. Our 3 key objectives. 1 is to increase uptake of family planning by 50% among women of reproductive age in the internally displaced persons camp. Our second objective is to scale up uninterrupted access to menstrual hygiene through menstrual cups, an innovative, durable, and sustainable way of managing menstruation. And lastly, is to improve the livelihood of women in the internally displaced persons camp by providing economic incentives to cushion the effect of the COVID-19 pandemic?
Thank you very much, Margaret. I was speaking to the key achievements of the project, and I'll be speaking across 6 main prongs, and just also call out that the achievements of the project were in alignment with the 3 main objectives. Starting with the first objective, we achieved over 50% increase in family planning uptake in the camp. We also had the opportunity to strengthen the supply chain of family planning commodities to the camp. We achieved that through advocacy to Abuja Municipal Area Council, and ensure that the government agencies responsible for supply chain of essential commodities, including family planning supplies, understand the need of the camp, and that is one of the key wins of this project. We also saw a significantly reduced barrier to spousal consent in the camp. So just to backtrack a bit, before the commencement of the intervention in the camp, we had a baseline assessment, and one of the main findings from the baseline assessment was that there was high level of spousal barrier to uptake of family planning in the camp. At the end of 1 year, our endline data showed that had reduced significantly. Also, we had over 1,000 free medical consultations through our outreaches. The main outreach was actually World Contraception Day outreach in 2020, and that was followed by a series of mini outreaches, and we have recorded over 1,000 free medical consultations for people, residents of the camp, through this LOPS intervention. Then we had 80 women empowered with financial resources to start their business and to support their business. Through this project, we were able to support and empower 80 women with $43 to strengthen their businesses in the camp. And that speaks to the role of empowering women in ensuring that they have a say on their reproductive health. And finally, about 492 menstrual cups were distributed to aid menstrual health and hygiene of residents of the camp. I'll allow Nkasi to continue with the conversation.
Okay. So the achievement we recorded from this pilot phase established a proof of concept of the mobile technology interventions in Wasa IDP camp. And it's also, the intervention will be pitched to development partners to source more funds for scale up and sustainability in other IDP camps and FCT at large. So these are few of the pictures, showing what we really did at the site and at the IDP camp.
So we identified 5 main challenges. The first has to do with the clinical providers for the period of the implementation, because we're able to get people to take family planning through the use of mobile phones. Some of them complained to us that they couldn't get access to care or the services because of lack of clinical providers, lack of health workers in the facility. And we are recommending that subsequent projects should put in place mechanisms to incentivize health workers in such communities, IDP camps, and this can also be extrapolated to hard-to-reach communities. Secondly, there was the problem of persistent stockouts of family planning commodities, and this was one of the reasons women were discouraged from taking family planning. So, for instance, some of them that started with a method of family planning and needed to come back to refill their drugs or to get injections, and by the time they returned, they couldn't get that method again. That was another barrier that we identified, and we are recommending steady supply of family planning commodities. I mean, it's just the right thing to do. Then thirdly, unavailability of men in the camp to hear about the message of family planning during the outreaches. Like I mentioned earlier, spousal consent is a big deal in the camp, and some of our interventions and our outreaches were targeted at men. However, many of those men that need to hear the message were not, in the camp. They have gone about their farming businesses and other means of livelihood. We are recommending two-pronged approach for this. One is to use variety of methods to ensure that all target populations are captured. And then the second is to conduct outreaches in the camp on weekend when most men will be available. If the fourth challenge that we are also flagging is high inflation rates. As you're aware, this is also a very, in quotes, turbulent time for the country in terms of economic stability. And so there has been a lot of inflation and high cost of commodities have really, gone up within the past 12 months. And that's affected the capital for women that we are empowering for their businesses. That narrowed their profit margin significantly. And we are recommending that projects that seeks to empower women, especially with financial grants and support, should take into consideration the inflation rate and how that affects their purchasing power. Finally, gender inequality. Most women in the camp were not educated. They had minimal ability to make decisions, even decisions that affect their bodies and their health and their personality. And what we are recommending is to ensure that interventions are all encompassing and women are empowered, to first off to make, ends meet, to make decisions about their finances and their health. Just to also run this up by saying that many of our recommendations were actually tested within the 1 year because we implemented the projects iteratively, and that is why for the stockouts we've been able to significantly solve the problem for Wasa IDP camp, but we are flagging it for scale up into other IDP camps. The unavailability of men, we deployed several other approaches to reach men, just to ensure that they get the message of family planning, and that influenced the way that the spousal barrier had been significantly reduced. The high inflation rates, the women were not just giving money, but they were also trained and monitored to ensure that they made the most use of the resources that was given to them. And then for the gender inequality, of course, that's also why we implemented the projects with the prong of giving them money to sustain their business or to start up new lines for their business during the COVID-19 pandemic era. So these are some of the challenges that we faced and the lessons learned as we seek to scale this project up in Nigeria within other IDP camps. Over and thank you.
I think that the one thing we also should highlight, if the other team members think so, is we were able to inaugurate family planning champions. Of course, we call them childbirth spacing champions in the camp, and those were majorly men. We had just very few women, which is the 2 women leaders in the camp. But again, they were very instrumental to supporting us with the outreaches because they were then being flagged and they went on as the face for family planning in the internally displaced persons camp. And that really helped us to get to the grassroots. I mean, they could speak to fellow men because we had the camp leaders, we also had religious leaders who committed to also speaking to the men during their sermons, either in the church, because it's a mixed religion. We had Muslim and Christians who also committed to speaking to men during the different religious gathering. So I think for me, there were 17 FP champions that were inaugurated, and they were able to particularly support us with the outreaches, aside from using other existing platforms that they have to talk to fellow men. And for the women, they were able to speak to other women about the importance of family planning. And that for us, hearing especially religious leaders speak positively about family planning is a plus to the project. Thank you.
So my first question is, what are some of the ways in which the Ingenuity Fund and 120 Under 40 has benefited you, or what were you able to do that was not possible before?
So to start with, the Ingenuity Fund was implemented across 3 prongs, and there was a implementation of mobile technology to improve family planning uptake, the distribution of menstrual cup for menstrual hygiene, and the empowerment of women with financial grants. What the project has allowed me to do that I think is really inspiring is to see how technology can be leveraged to improve access to family planning in hard-to-reach communities, or communities where people, where we know that people live, significant number of people live below poverty line. So for us, what we did was to deploy a mobile technology solution. We leverage SMS services and toll-free line, and we engage virtual family planning providers to respond to people's questions and concerns on family planning. This is inspiring because we tested an hypothesis. Actually, we wanted to know if people in such communities will actually reach out, to ask questions about family planning. We engage virtual family planning providers who are nurses and who understand the local language. At the end of the implementation of this project, it will interest you to know that significant, more than half of the people that called, that reached out through the toll-free line, actually went ahead to do family planning. And when we asked people in the community if they know about family planning, out of 101 respondents, 98 of them actually know about family planning. And more than 90% of those 98 got to know about family planning through the this project implementation. So that was really inspiring, and it gave some sense of fulfillment that baby steps, with people in such communities can actually make a lot of difference. And just to also add that the spousal resistance or barriers to family planning was also significantly reduced, and this was achieved because we consistently sent out SMS to residents of the camps. We sent out SMS in the local language and in English to residents of the camps. Males got SMS, their wives got SMS, and from our conversations with them in focus group discussions and key informant interviews, we discovered that the SMS actually sparked conversations in their homes about family planning. And many of the men that were resistant to family planning actually came out to ask questions. And, that's also led to positive outcomes. The final thing I want to touch on is the significant role that the family planning champions played in ensuring that there is a lot of momentum on the progress that we achieved with the projects in the camps. They actually took ownership of the work, and they have demonstrated that they can even take it forward after the 1 year project implementation timeline. I'll pause here for my colleagues to add to that. Thank you.
Thank you, Adebisi. Okay. I just, for me, it was really great to see that strong relationship that we were able to establish between the receipt of the business grants as well as the agency to make decision in the household. So at the end of the from baseline to end line, we discovered that there was 39% increase in decision-making power of the women in the camp. And that was actually a fairly strong linear relationship between the grants that they had received, when you put it side by side, that's agency that the women were able to. So I could just imagine that without the grant, I might as well still continue to do the good work of talking about family planning to the women, but this was just in the face of COVID, and so much has happened to their businesses. And for me, it was, while it's important to talk about family planning, it's also important to cushion the effect of COVID-19 pandemic and the whole issues that has come. But importantly is to see how that relates to their agency and actually decision power for even the choice of whether I insist on using a condom or not. And from this study, we're able to discover that strong relationship between their agency and their financial power. So I could just imagine that without the grant from 120 under 40, I might have been able to continue to talk about family planning, but might not be able to have that ability to support the women with the grants, and then thereby seeing that relationship that exists. So for me, it's one thing that I didn't see myself doing personally, but with the grants, it was able to clearly show how the relationship between decision-making and being economic empowerment. I know there's several or some literature on that, but I've really not seen that clearly, especially when we talk about women in internally displaced persons camps. So that for me was really a great, seeing the result of the end line. I was super excited to see that we could be able to determine that relationship between being financially empowered and having to make decisions in the household.
So for me, the grant gave me the opportunity to work in consortium with two other powerful organizations. So I could, similar thing with what Margaret said, we could go ahead with our menstrual hygiene management programs, but but working together with other organizations gave us a more of visibility and sustainability, in the sense that they are not just seeing us taking care of their women, the young women and girls with menstrual hygiene products. They also believed and saw us, take care of other women with the economic empowerment, and this a kind of softened the hearts of most of their husbands, right, or their spokespersons, and made them allow the women to have access to our family planning services. So the consortium, we coming together, made the project more stronger. Not that working separately doesn't make it stronger, but it strengthened it the more. So the grant gave me the opportunity to see that working in consortium, it has a huge impact and lasting impact also.
So 2 points quickly. The first is the fact that with this grant, we were also able to bring the camp into visibility when it comes to policymakers and decision makers. For instance, for the World Contraception Day, we were able to bring representatives of the ministry, the federal ministry in charge of internally displaced persons to the camp, and that gave them the first-hand experience of what is going on in the camp. And that's also potentially translated to meeting the needs of the camp beyond family planning. So that's one thing that's, this grant has, helped us achieve. The people that were in quotes neglected have been brought into limelight. And then the second thing is how the advocacy that we have done as a consortium is translating to impact in the community. I've highlighted how that has led to the solution to stockouts, stock out of FP commodities in the camp. And for us as individuals too, we were invited to join the National Technical Working Group on Reproductive Health, for the country. So those are some of the big wins for this project that meant both, meant wealth and added to us as individuals and also helped the community. The fact that our work was also highlighted in Nigeria Health Watch. Nigeria Health Watch is the leading health, journalism platform in the country. So that was a very good exposure or visibility for us as individuals, as Ingenuity Fund winners, and also for the camp, who are actually the reasons, for everything that we have done. Over.
That's a really great point. And with that, I was wondering if any of you have any insight on maybe some of the most effective ways that youth can advocate for sexual and reproductive health and hold people in power accountable for access to contraception.
For me, again, it was really amazing to have 3 powerful young people doing amazing work at the internally displaced persons camp. And just listening to your question about how youth can really advocate and be able to move things forward reminded me of how we started. So when we started, we decided to do a community visioning, and that really helped us to secure ownership and also understand the community. So rather than just get into the community and say, oh, hey, we're here, we want to provide family planning, we have money for some people, what we decided to do was to first acquaint ourselves with the leadership of the camp. And in fact, that was when it became very clear to us that the internally displaced persons camp have structures. They differ in different internally displaced persons camp, but this particular internally displaced persons camp, WASA, where we worked, the camp chairman, the secretary, the women leader, and they also have different community heads. They have about 7 communities, and that really is for them to be able to distribute incentives and all of that. And we were able to leverage on the existing platform to bring together all of those leaders so that we could first get their buy-in, and they were able to own the project because from the start, they understood why we were there, and we were able to also get them to contribute to own the project itself. So for me, the big lesson, while we plan to do that, is that having that introductory visits, courtesy call, visioning meeting to really get them to understand why we're there, and them also taking ownership. And particularly, it's always also for every young leader to understand the entry points. So I remember our first meeting, instead of diving deep into family planning, and of course we're also very careful about the local nuances, so instead of saying family planning, it was childbirth spacing for us, and we had to then start with a story about what it means for women when they don't have access to facilities, and they began to tell us horrible stories about women who have had to die due to childbearing complications. And eventually that was how we got into talking about what then do we do? And you could hear them actually saying, I think we need childbirth spacing method, because that would mean that you wouldn't even think about childbearing complications and all of that. So to wrap up my point is to say that it's important to find the entry point. It's also important to gain ownership and be able to bring leaders, the gatekeepers, to take ownership of whatever intervention, no matter how passionate you're about what you want to do. If the gatekeepers are not involved, if they are not meaningfully engaged, if they don't take ownership, then it makes it really difficult. Our last meeting was, they said, no, you can't leave us. We know we'll still be with you. And just like Adebisi and Nkasi mentioned, it has really brought a lot of visibility to the camp. And we had to tell them that even though we're leaving, a lot of people have been asking about you. And we've had either from family and friends or even some organizations, they've had to reach out to us personally to say, we would like to go to this camp. So despite that we've wrapped up in the project officially, we still have people visiting the camp to say, oh, this is the need. And of course, before we also said bye to the community, especially the FP champions, the childbirth spacing champions, particularly took some role to say, we will continue to sensitize our men, we will continue to do this, we will ensure that the women are being catered for and all of that. So that's, for me, it's really huge and something every young leader would should take note of when working in internally displaced persons camp and in the communities generally.
Thank you very much, Margaret. The role of community entry and community ownership cannot be overemphasized for the success of our project. I'll just add about 3 more points to that. And the first is our appropriate messaging also helped, the success that we have achieved. For instance, like you mentioned, at the early point of interactions with the community, we were not using family planning. We were using child spacing as a terminology. I also recall that we brought in people to act drama, drama on family planning. So we made the message that we want to communicate to the people in the community very graphical, and we brought it in a way that they can relate with. And I think that is very important to every young person out there that wants to actually make a difference in the community. It might not be appropriate to, copy and paste approaches, but it's important to understand that for every target audience, there's actually a way to communicate, with them. Throughout this project, we sent out 8 SMS, per month in Hausa and English. And, all of those SMS, all of those messages were actually reviewed by SPCC experts, for appropriateness, for completeness, for clarity. And we can relate with how that has translated to, increased level of uptake in the community. The second point I want to add to this is the use of technology. It is often assumed that technology works in the cities, it works in Abuja and, Lagos and, state capital, But with this project, we've been able to establish and prove that even people in hard-to-reach community can be, can benefit from technology-driven interventions. We designed this in a way that it's not so heavy on internet. Does not require internet, and it's not heavy on the people in the camp having sophisticated devices, and they don't pay anything for it. And at the end of the day, we received 108 calls, from residents of the camp through our toll-free lines. And that speaks volume. It means that people would actually reach out for information on on family planning if that platform is provided, for them. And just like technology has, changed the face of humanity, with technology, we were able to actually reach more people. What we are reporting are the direct, data that we have, not to talk of the family members of the people that call, or the friends of the people that receive our SMS, and the people that they had conversations with. And finally, is the importance of continuous follow-up. So we for people that call, for people that receive our SMS, the virtual family planning providers that were engaged for this project were responsible for calling them, following up with them. So if you call to ask about family planning options, and we provided, appropriate information to you, and we recommended that you go to the clinic to get the service, the virtual family planning providers that we have engaged, were saddled with the responsibility of calling back and following up on them. We also, deployed this continuous follow-up in the with the women that were empowered with the grants. We just didn't give them money and ask them to go. It was not a giveaway. People were actually followed up to be sure that they actually used the money for what they proposed or intended to use the money for. So just to recap, appropriate messaging, technology, and continuous follow-up were some of the key, highlights for our success story, in addition to community entry, which was very key. So,
Well, it sounds like you've come very far from your start and learned a lot along the way, and definitely lessons learned, especially in terms of continued engagement and follow-up and all of the things that are working, especially as you wrapped up your project. And I would love to know how you all got inspired to enter family planning and reproductive health in general.
yeah, so for me, it's a personal story. I come from a very large family. I'm the sixth born out of 10 children. So I often say that my family make up a football team with, with one extra player. And I grew up to understand what it means to have a large family, how my parents, especially my mother, needed to sacrifice a lot to ensure that we all got quality education, and how our family, you know, how our family fared compared to people with smaller family. So it was a natural reason for me to be a family planning advocate. I saw people with smaller families of 3, 4 children, the opportunities that children enjoyed compared to myself and my other 9 siblings, how we had to struggle, through school and get basic things out of life. And in addition to that, it's the fact that there were also mentors that believed in me. At the early stage of my career, the people that helped shape and guide my career path were actually sexual and reproductive health advocates, and that also, to a large extent, informed my decision to continue in this path. I see family planning as one of the cheapest way to change the world, to make a difference in the world, to ensure that people, have access to quality life, quality education, and are empowered to do great things in life. Yeah, over.
So menstrual hygiene management is a part of our sexual and reproductive health project, which is what we cited in this project. So we ventured into it because COVID-19 pandemic actually exposed the need for sustainability in menstrual hygiene management in rural communities across Nigeria and IDP camps. So we realized that a lot of people, because of the restriction that the government had to put in, to avoid ongoing transmission of COVID-19, from one person to the other, people did not have access to all the donations of, menstrual materials like the pad and the tampon. So they rather resorted to alternative means of managing their menstruations by using dirty rags and using leaves and ashes, like so many gory stories. And then some of them already had a reusable pad, but it was already wearing off before the lockdown. So we thought that people in the rural communities and IDP camps deserve to have a more sustainable means of managing their menstruation in a hygienic way. So, and then we came up with this menstrual cup, which is already a project we started. We already started like pilots and like testing to see how it works. And, and it landed us here. So we have given every woman, like almost 400 women who received our menstrual cups, they now have a hygienic means of managing their menstruations for the period of, between 5 to 8 years from now. So they don't have to worry anymore about, about the fact that they are going to run out of pad or tampon, or that their reusable pads are going to be damaged or destroyed. So for the next 5 to 7 years, they are sure that they are using a hygienic means to manage their menstruation. So that's why we focused on menstrual hygiene management.
So for me, again, talking about family planning, it's probably the last thing I thought I would ever get into. And when I tried to remember 2012, when I officially, and that was on Valentine's Day, February 14, got into the development world. Of course, I've always wanted to support women. I'm from a girls only home, and we often say we're girls hostel because my mom has 7 girls, and every time she would say I had 7 girls because I wanted a boy who never came, But again, while I was trying to reach out to fellow girls, and of course that's also what inspires Stand With a Girl initiative, I began working with an organization, Center for Girls Communication and Center for Girls Education, and it was in rural community in Zaria, Kaduna State of Nigeria. And basically for us then, it was really using education as a means to delay child marriage. And while I talk with girls have several dreams. So most times you start with girls who would say, I just want to be a housewife. But with time, the same girls say, I want to become the first nurse in my community. So I felt, yes, education is all that they need. And I was proudly championing girls' education until one of those girls, who is very smart, bright, suddenly had to get married. But because she has gone through a lot of life skills and she was able to negotiate with the husband, she told her father, it's okay, I get married, but the husband has to sign that it would allow me continue my education. So while that wasn't a perfect win, it was still some win, because here is a girl who would barely negotiate before, but now can negotiate through and say, even if I get married, I'm still able to continue my education. But it happened that a few months into the marriage, she got pregnant. And then the first time I was seeing her after our wedding, she told me she was pregnant, morning sicknesses, she couldn't get back to school. And then we started the conversation around, was it your choice? She said, no, but I don't know, what else would I have done? Who decides whether I get married? She had no idea about contraceptive. She doesn't even think she has that power to be able to decide, but inwardly, she would have loved to delay childbirth until she's ready, because she wanted to get back to school, and that wasn't what she wanted. So for me, that was what sparked my love for family planning, because I was beginning to say, oh, so family planning can save life. It also saves destiny, because I watched Aisha grow through that period from having 1 baby to 2 to 3, and just the hope of getting back to school, because it wasn't just about the pregnancy. When the child came, it was a lot of responsibility. She was very young and just coping with everything. In fact, the husband was so sarcastic, which got me angry at some point, like, she should go to school, I'm not stopping her, but really she couldn't get to school with the morning sicknesses and the whole lot of responsibility. And for me, that was when I told myself family planning is the way to go. So while it's good to get them education, part of the education that they need is to know when, how many, and have that power to be able to decide for themselves and by themselves whether, when, and how many children they want to have. And that was, for me, what brought me into family planning space.
Thank you so much for sharing your stories. And it really, I personally love hearing everyone's sort of origin story, if you will, into family planning and reproductive health. And a lot of times it seems that it's a very personal experience that has brought you to this field. And a lot of people do say, you know, this might not have been what I pictured myself doing, but I certainly can't picture myself doing anything else. But the world certainly looks a lot different now than it did when a lot of us entered the field. And I would love to get your thoughts on how you feel maybe the global mission of universal access to contraception has changed since the onset of COVID-19 and kind of where we'll be in the future.
Again, universal access to contraceptive, I am glad that the advocacy hasn't stopped. No doubt, a lot has happened with COVID. In fact, let me begin with investments. So the government, non-governmental organization, a lot of priorities have had to change. So it looks, I was so afraid even at the wake of COVID, because it looks like we're going to lose the so much earned and the so much gain in family planning, because now it didn't look like it matters. What matters is COVID-19. So everyone needs to be safe before you will talk about something else. So the investment was shrinking, which was already shrinking anyways before COVID, but then the priority of the Federal Ministry of Health in Nigeria changes. But I'm glad that the advocacy didn't change. I was particularly excited when a group of people who were part of the presidential task force, I wasn't opportune to be on it, but were able to push for including family planning messages, even as we were rolling out lots and lots of messages in COVID-19. The great thing that family planning has also done is that it has strong advocates and also strong sexual and reproductive health experts. So strong social and behavioral change experts. So you have organizations who were already doing amazing messaging around family planning, when engaged to also develop messages for COVID-19. So it was really an opportunity for there to be an integration. So while there were some, for me at some point it was like 2 steps backward, but we were able to a large extent get back again, because the ground was so fertile, because there were a lot of young people, civil society organization, champions at different levels, either at the state level, the federal level, the local government levels, who kept on talking about family planning and felt that, oh, there's a lot that is happening. And because family planning is also in the basket of sexual and reproductive health, we know a lot happened around the sexual-based violence, because people were then stuck with the abusers and all of that. So there was so much advocacy around ensuring that sexual and reproductive health and rights was not neglected despite COVID-19. However, I also know that particularly when it was really hard during the lockdown, a lot of young people ran short of condoms. They could not go to the facilities. People were more scared for their lives than, okay, I'd rather have 10 babies than get COVID. It was really scary. So a lot happened. I know I personally wanted to get family planning at that point, and then I put a call across to the family planning provider that I was linked up with. And she said, oh, while I would like to provide that kind of service that you need, I will encourage you to just use condom because I need to sterilize my equipment, but the other because the way the lockdown then translated into some cadre in the health for health workers weren't coming to. So it wasn't a job to clean up the places and clean up, sterilize some equipment that would be used for IUD. Actually, precisely, that was what I wanted. So that was just me. I can imagine the number of people who wanted. So it also limited the choices, apart from even having access to it. So I had to make do with what I had. Again, we know that young people, they would always, PPMVs was that first call, but the cost also was something that wasn't so that wasn't readily available. But the good news again was the fact that it made a lot of people become innovative, just like we had the mobile technology, and a lot of young people began to develop different means to reach other young people to be able to provide services. So by and large, I would say it tried, but we were able to overcome the so many challenges by using innovative ways, leveraging on social media to really disseminate adequate and accurate information on family planning and dispel myths and misconceptions. Thank you.
That's amazing, Margaret. You captured all the important points, to that question. Yeah, the only thing I just want to add is, no doubt, COVID-19 also showed us that family planning cannot remain a vertical program in countries. So a lot of essential services suffered, but we need to take family planning advocacy up to a level where it is considered as human rights. It is considered as something that we cannot do without, irrespective of the pandemic. COVID-19 might not be the last pandemic, but we should start positioning family planning as that essential health services that cannot keep suffering when there is a pandemic, or like we see in some countries at the moment, when there's a war, when there is insurgency. We should start thinking of how to preserve family planning, access to family planning for women, for girls, despite shocks like COVID-19, presented to us. And that speaks to integration, that speaks to wearing the cap of health system strengthening in financing, in policies, as it relates to the health of young people, girls and women generally. Thank you very much, Margaret, for that video.
I definitely think that speaks to the fact that the sexual and reproductive health community as a whole is resilient, and family planning is essential. And this essential work has definitely continued through COVID and will absolutely continue in the future. And speaking of COVID-19, our 2020 Ingenuity Fund was focused on COVID-19. And a lot of times when we're discussing this topic, we do talk about all the negative effects that COVID-19 has had, either on our work, on our personal lives, maybe on our projects. But I was wondering if anyone can identify maybe some of the ways that COVID-19 has had a positive impact on either your project or your personal journey, or your work as a whole.
Yeah, so speaking directly about the projects, the fact that COVID-19 forced us to be innovative, many of us couldn't go out, and when we had to go out, we had to go out with a lot of precautions, wearing face masks, observing physical distances, and that gave some credence to telemedicine, gave some credibility to our approach to use mobile technology to increase, access to sexual and reproductive health, specifically family planning information and services. And that really played out very well. COVID-19, kind of came at the point where we needed to test the hypothesis that will people actually call or reach out to ask for information on family planning, and they did call. It also meant that we were able to protect both the health worker and the people coming for services. It meant that we were able to regulate the number of people that come to clinic. It meant that potentially we can, give people appointments, and rather than what we observe in many of the hospitals that are always, stocked with a lot of people, at times people can know when they're supposed to call. Again, family planning is not an emergency service, but it must be available when needed. That's the trick. So with technology, we can achieve both. We can actually get people to plan their visits, get people to plan ahead of their refill. They don't need to run out of stock, or they don't need to come a day before they actually need to refill to get the commodity. So I think one positive side to COVID-19 is that it forced us to think outside the box. It forced us to consider how we can apply known solutions to unknown people, to unconventional people in unconventional places. And that for me was a very big win. And professionally, COVID-19 also gave me some time to reflect. I was forced to sit, I was forced to pause. On a lighter note, I told a colleague recently that I had not traveled out of Nigeria since COVID-19 struck. That's very strange, So that's in a way also, gave me some time to reflect, think about my career path, and think about my choices and my decisions. And most importantly, think about things that are very important to me, give more time to my family, and do things that are important to me.
So for us, the COVID-19 impact was the positive thing about it is that it made us more innovative. So we sort of more sustainable ways of doing things. So instead of going to the field once in every 3 months to distribute menstrual supplies, we can as well do it in a way that it lasts for about 4, 5 years, 7 years, depending on how each person manages their product, which we gave to them. But so it made us realize that we can actually be innovative in the sense that we can think out of the box, like Adebisi said, and do things in a more innovative way than in a regular way. So that's the positive part of COVID-19 to our work.
Thank you for sharing that. I think it's really important to reflect on the positive aspects, the challenges that we face. And this has been an ongoing challenge, and it's looking like it will continue to be an ongoing challenge. So we look forward to seeing what some of the innovative solutions the community comes up with in the future, and how the landscape will change. The future of family planning certainly is bright, and that is thanks to all of the youth that are doing the work now to push us forward in the future. So we have to make sure that youth always have a seat at the table when we're discussing these things, and we will have to rely on their participation and their advocacy to push us forward into the future. Well, with that, I would love, before we wrap up our conversation today, to just get some final thoughts from you all. Any things that we haven't addressed that you'd like to talk about, or any upcoming activities that you're pursuing?
For me, I would say that the branch has been very useful. Not just the money, you know what I mean, but also the fact that I'm able to work with 2 other amazing young leaders. I've learned so much from them. It has also, for me, shown the power of collaboration, and there's so much that we can do when we work together. And again, it would be to say to 120 under 40 to keep up. There's just so many amazing ideas outside, and as many funds as we can get to be able to bring those ideas to limelight, that will be great. And for us and for me personally, I still look forward to working in the IDP camp, the particular one that we work with. And the reason is because while we were able to reach women of reproductive age, for the young people unmarried, it was very, very sensitive. In fact, one of the meetings, the initial meetings, the camp secretary made us watchdogs. He said, if any of the unmarried girls come to the facilities looking for family planning, report to me. And I just couldn't understand that even at this age and time, we would still restrict people from having access to accurate and adequate information and services. So how it would need a new set of learning, it would need a new set of approaches, but I really look forward to still working in that IDP so that we can reach more young people, especially unmarried adolescents, with the information and services that they need. Yeah, that's for me.
For me, I want to start by saying thank you very much for the trust, for the opportunity, to be awarded the grants. The fact that you could trust us to work together, to deliver on the mandates and the content of our protocol or proposal was really encouraging. And the success that we have achieved in the past 12 months also speaks to the power of collaboration. That cannot be overemphasized. The best of us could have achieved just what one person can achieve or what an organization can achieve. So I think that's one of the greatest take home from this consortium is actually for young people to open up more to collaboration. There's actually power in collaborating, in reaching out to other people with similar ideas, similar goals, and visions and missions to work together. In the final analysis, we want to make a difference in the world. We want to make more people access family planning. We want to make sure that more people can lead healthy and productive lives. So I think that's a big one for us. The fact that we've been able to work together to achieve all of the successes that we have enumerated on this call and many more that we couldn't even get into. Thank you very much, Amelia.
I would love to say, the first part of it is thank you. Thank you to 120 of the 40. Thank you to Bill and Melinda Gates and everyone and the team for this grant. It worked wonders, and it's really amazing. Like my colleagues have said, working with Adebisi and Margaret, we achieved more and working together, and it's really awesome. And we are not done yet, like in the sense of the menstrual hygiene part of it, because from our end line, about 40% of the women who received our menstrual cups still need continuous education and follow up on how to use the menstrual cup. So we look forward to going back there and continuing this project. But we are grateful for all we have already achieved in this short period of time through the Ingenuity grants.
Thank you so much for taking the time to join us today and discuss all of the wonderful aspects of your Ingenuity Fund project, as well as some of your personal journeys and what excites you about the future. Thank you so much, and we'll see you on the next episode.